Hi, this is Dr. Kelly Miller, Saving Your Brain. I'm going to demonstrate how to test for primitive reflexes. This is one of my staff named Sue here. She's been kind enough to help us out, and I don't know which ones we're going to find, so some of them we're going to find and some of them we aren't. But I just want to explain how we do it and what we're looking for, okay? So the first one we're looking for is the rooting reflex. So we're going to come about a 45-degree angle, and we're going to come to the edge of the lip, and we're going to go across both that. See that contraction in the chin there? That's a positive reaction. Now you may have a younger child who is really developmentally delayed, and they may actually open their mouth and turn as if they're going to nurse. This is why it's called the rooting reflex. So she has that on residual. And then again, we're seeing that contraction in the chin, seeing the mentalis muscle right there, all right? So that's a positive response. So again, that's in the medulla, and that's the area of the brainstem. We're going to check the snout reflex. So we're going into the lips, and we're going into this fulcrum. There's like a little, if you'll feel around above your lip, there's like a little hole right there. It's called the fulcrum. And so that is negative in her. Positive response would be kind of some pooching. You know, kind of looks like one of these ladies who's got too much injection in their lips, you know, and they're walking around like this. So this is a palmar reflex we're going to check now. And we just want their hands relaxed, and we're going to come across from the thumb to the little finger. Hypothenar to little finger, thenar to, and we're starting to get a little bit. So if I come particularly right here, we're getting some more contraction in the fingers there. Okay, so she has a positive. We'd rate that 1 to 4. A 4 would be like they would clamp it, just like a little baby. If you put your fingers in there, like a 2-month-old, they'll clamp down on that. And we're going to do this one. And we'll see that the middle fingers are curling up, the middle two and the little fingers all curling up. So she has, again, about a 1 to 2 to 4. We're going to test the Babinski. You want to come around this way? Okay. So we're going to test the Babinski. And what we're doing is we're going from the calcaneus, the middle of the calcaneus, we're going to do like a little banana hook to the ball of the foot. All right? Now, she has a normal response. She is flexing her toes. That would be a negative Babinski. An abnormal Babinski is she's going to extend her toe, extend her big toe, and spread her toes. So again, this is a normal response. Okay, negative Babinski. Okay, so we're going to get you up if you're in a crawling position and face this way. So now we're going to test the asymmetrical neck reflex. So just relax your head. Okay, so we're going to get their head in a neutral position so it's aligned with the rest of their spine. You're just going to cradle. Don't get an earring in your finger like a. Cradle the head, and we're going to turn it, the back of the head, towards the elbow. And we're just going to turn it to those resistance. We're going to do it multiple times. And this is a negative response. I want you just to bend your elbow a little bit now. Okay, that would be a positive response. And the more she did. Okay, now let's try this side. Okay, now let's bend it. Okay. So depending how far we bend it, all the way down, that would be a 4, just a little bending. So really, if you just turn it and you just hold it, lots of times it'll bend. Just give me a little bend there. Okay. All right. But she has a negative asymmetrical neck reflex. So this is something that you're going to find not only in children, but in adults, and usually older patients will have chronic neck and shoulder pain if they have a positive ATNR, like on the left or right. They're always like their upper trap, neck, shoulder area. Okay, now we're going to test the spinal galant. This is a reflex that's active particularly in the hyperactive child. It's associated with fidgetiness, ants in your pants. you know, it's a kid that's sitting there and their head's on a swivel. Every little sound, every little sight, it distracts them, and usually they're, you know, have trouble sitting in one place. So the other thing this is also often associated with is prolonged bedwetting, you know, nocturnal bedwetting at night, or controlled bowel. I once had probably a 10-year-old boy, 11-year-old boy, and he pooped in his pants almost every day at school. And the thing about it is, he didn't really care. So I think after about 2 months of care, that stopped. And because he started getting the perception that that's not a socially acceptable thing, and we corrected it, but that was related to the spinal galant. Okay, so if we're just gonna divide, here's the spine and here's the lateral margin of her trunk, we're gonna divide that into thirds. So we're just gonna come from the ribs, about 1/3 down, 2/3 down, and then right here. So most people will be most active in this lateral part. Now she's not active. I usually do this on the skin, but for her, we're appreciating her modesty, so we're keeping her shirt on. So this is 1/3, 2/3, and then the lateral. And again, she's no response. You want it significant. You want to actually leave like a little red mark. I mean, don't make them bleed, but I mean, you want significant pressure. Okay. So we're now going to check the symmetrical neck reflex. So we're just going to look up a little bit, and we're just going to push her back. Okay. So just your normal muscle tone, even in a 2 or 3-year-old, they're going to be solid like that, okay? Or we can push her down and nothing happens. She's not moving, okay? But you'll see in these kids with poor muscle tone, they'll just collapse. They'll just fall back. So if I go back, kind of fall back, let your bottom hit, they'll just go down like this, okay? And we go like this, just let your arms collapse down, and they'll go down like that, okay? All right, so she's doing pretty good. She's seen that happen before in the office. Okay, so now we want to check some standing. So we're going from a sitting to a hi. So just to review, we're checking primitive reflexes. The first we did sitting. We checked the rooting reflex. We checked the snout reflex. We checked the palmar reflex. We checked the Babinski. That's 4. We had her in all 4s. We checked the asymmetrical 5. We checked the spinal galant 6, and we checked the symmetrical neck reflex 7. So now we're going to check the Moro reflex. That's a negative Moro. You can just do it like that when they're not expecting it. You're just going to make a loud noise. So the people with Moro, which is interesting, see her eyes. If someone has that, you know, they'll flinch, but they'll even see you do it, and you do it, and they just keep flinching, okay? So that's a master reflex. We can also, I'll show you when we stand up how we can do it. Another way we can check the Moro reflex. But people who have Moro reflex have very high sympathetic dominance. That's fight, flight. And you'll also usually see people who have Moro, they have an enlarged pupil many times because, again, that's a response to the sympathetic fight-flight nervous system. So we're going to have our patient stand down. And which way? We want to go sideways, maybe, like that? Yeah, there we go. Let's do this. Okay, come forward a little bit. All right. So what we're going to do, this is another, we're going to put your arms out. And this is another way we're going to check the asymmetrical neck reflex, okay? So just relax. I'm just going to turn her head. And what will happen, so this is negative, but sometimes why we do both, because it picks up better in one way or the other. Okay, just let your left arm float with you. This would be a positive response, okay? See how she's moving? And then when they do that, they even kind of get out of balance, like they're going to fall, okay? So we're going to go this way and let it float, just slide a little bit. Okay, and depending on how far the arms go is how bad it is. Is it a 1, is it a 2, is it a 3? If it's all the way over and they lose their balance, that's a 4, okay? Very severe. Now we're going to do the labyrinth, and so what we're going to do is I want you just to close your eyes, and I'm just going to tilt her head back, and then I'm just going to put it in full extension, then I'm going to let go. Okay? Now she's pretty steady, what we're looking for is a fluctuation A to P, okay? Like I had a little boy I did the other day, and I put him back like that, and he fell back. You know, I had to catch him. He would have fallen all the way down to the floor probably. All right, so we go here, and we go 3 times. So sometimes it will get worse. She's pretty good. Now if we see movement this way, left or right, that's not indicative. It's the movement forward and backwards. Okay, pretty steady. So labyrinth is associated with vestibular dysfunction. So now then, okay, so we've done Moro, that's 8. We've done labyrinth, 9, and we did a standing asymmetrical neck reflex. Okay, so I'll just give you an alternative on the Moro. Okay, I want you to close your eyes. I'm going to clap my hands, and I want you just to fall back. I'm going to catch you. I'm going to just fall back. I'm going to catch you in about 6 inches, okay? Just let yourself fall back. Okay, just let your upper body fall back. I'm going to catch your shoulders. You're not going to, just, okay? Mm-hmm. No, just fall back. Trust me that I'm going to catch you. Okay, you're not going to fall. Okay, so that's just that's kind of a little bit. Okay, there you go. All right. Now, so what we're looking for in that start is like a little baby. If you clap and their arms jump. Now I had a woman once that I did this on, and this was an adult, and she almost fell to the floor, bent her knees, she wet her pants. That's how severe the Moro reflex was. So those are the 10 primary reflexes that we check.